Greetings from Narayana Health. This is Dr. Hiremath Sagar, working as consultant pediatrician and pediatric intensivist at Majumdar Shah Medical Center, Narayana Health City, Bangalore. Today I would like to talk about normal newborn care. As we all know that there are many young parents and they have got only first baby, so they want to know about the basics of the normal newborn care. I will keep it very brief. So first is the feeding part, that is, as you all know, breastfeeding is the best. So we all have to ensure that the child is given only the breast milk and not anything else. That is the first thing. So how to ensure that the child gets adequate milk? The first thing is to keep the mother happy. The mother should not be stressed. She should be relaxed. Because if the mother is stressed or she has some worries for any other reason, the hormones which are needed released from the brain for milk production will not be released and the milk output will come down. This is the first thing. Second thing is you have to ensure that the mother has good diet. Okay, so the mother has to eat good diet. No need to restrict anything for the mother. Don't think that if the mother eats some specific food, the child will have cold, the child will have jaundice, the child will have hot, etc. Nothing like that. Mother can eat normal diet, all vegetables, fruits, hot, sour, cold, everything she can eat. In case the family is willing to give non-veg, the mother can eat non-veg too. There is no restriction as such. The third thing is the positioning of the baby when feeding. So mother ideally should keep the baby in a very comfortable position at an angle of 45 degrees and ensuring that the baby's mouth covers both nipple and the areola of the breast. Keeping the baby's mouth only on the nipple will not provide feeding adequately. It will lead to biting of the nipple by the baby and causing pain and injury to the mother's breast. So please ensure latching is proper. That is, the baby latches onto the breast, both including the areola and the nipple. Usually it takes couple of days time. It won't happen immediately. So once the delivery has happened, keep trying for next 2 to 3 days, and then once that interaction between the mother and the baby is successful, then you don't have to worry. The feeding will be successful. So first important thing is to ensure that the breastfeeding starts and keep patience for the first 2 to 3 days. Take help of the lactation nurses or pediatrician doctors who can help you and guide you over the breastfeeding. Second thing is the urine and motion. So many parents ask this question, my baby has not passed urine, my baby is passing more, etc., etc. So usually a baby will pass around 6 to 8 times of urine in 24 hours, and the motions can vary from once in 3 to 4 days to 10 to 12 times in a single day. So both the ranges are normal. Okay, some babies will have a little bit of vomiting, again that is normal, so no need to worry. They may yawn a bit, they may have hiccups, and they may do a little like this. These are all normal things, so you don't have to worry about it. So what about jaundice in the newborn babies? All babies who are born will have jaundice to some extent. Only about 10% of babies will need treatment in the form of phototherapy. That is, we need to keep the baby in the blue light. So no need to worry. As I said, all babies will get jaundice. Only 10% of them need treatment. And usually the jaundice will resolve in 2 to 3 weeks time. Yeah, this is mainly because of the immaturity of the liver in the newborn babies. It's quite a common condition. No need to worry as such. Coming to the care of umbilical cord. So you would have noticed that your baby has got a small umbilical stump. I only suggest that you have to keep that umbilical stump and the umbilicus dry. So whenever you give bath to the baby, ensure that it is dry by taking a neat cotton cloth and dabbing it dry. If you keep your umbilical cord and stump wet, then it can harbor the infection and have an umbilical sepsis. So you just need to keep the cord dry. Coming up with the skin care. So how can you take the skin care? So you can give bath of the baby immediately and then later once you go home also. And what I suggested, just don't do any use multiple this all products of various companies. I would just say just use coconut oil or olive oil for the massage of the baby and then give bath to the baby with lukewarm water. You can use basin, and soaps and other things are ideally suggested after 1 month of age. So just do a oil massage and take a basin and then apply on the body, and with the lukewarm water you give bath to the baby. And when you're drying the baby, don't rub the baby's skin because it will injure it. So what you have to do, you have to dab the skin dry. And you can use diapers, and whenever the baby passes motion, you have to change it immediately. And in case the baby is passing only urine, maybe every 6 to 8 hours you have to change the diaper. This is about some of the basic facts and how to take care of your newborn baby. Thank you.